So if I'm considering the hamstrings in a seated position, the hamstrings are obviously not exposed. I have to be very awkward and get underneath the patient's leg, so it can become quite cumbersome. However, if I take the back of their thigh out of contact with the table, I can have some access. And simply what that would look like is if you put your foot on my thigh, then I can now have some access to push and to pull. Pushing is okay. Pulling, there's something right about there on that finger, right? So it's not an ideal angle, but it's an option for me should I want to work on the hamstrings with somebody who is unable to lay in a given position. Say they're not as able to lay in prone. Another thing that I can do is I can come in with both thumbs and I can split the hamstring so I can assess here. So I just move myself a little further over and it's yield to pressure. There's something on the medial side you agree about there, right? And it's just whether or not it yields. It's maybe less comfortable as I moved up, right? Again, on the medial side, there you go. So it becomes an option that's exceptionally similar to something that I can do in supine with the flexed leg, but now it's in seated, the patient's controlling themselves. So maybe this is comfortable, maybe it's not, but it's just a consideration for those times when you're gonna have a harder time in any position other than seated.